So welcome to our new patient orientation. The goal of this orientation is for you guys to get a better understanding of your health, how your body works and how it heals, and a little bit more understanding of chiropractic. Because I have found over the years that most people don't understand what chiropractic is about. They think they go in and get cracked and then their pain goes away. But I want you to understand why that's happening. So we're going to start off with you 20 days and counting. So this is you inside of the uterus, and you can see at the top this person's brain lobe is starting to form, and then it connects and there's a spinal cord there. So this is what makes up your nervous system. It's your most important system in your body, and that's what we work with as chiropractors. This is going to dictate how the rest of your body is going to form. So now we have a little bit further down the road, 5 weeks inside the uterus, and you can see this fetus is actually starting to develop that spine in the middle. Now, how many of you were taught to take care of your spine growing up? So none of you are raising your hands, I see. Now you're taught to take care of your teeth by brushing your teeth every day, right? Now, do you brush your teeth because you have pain? Or do you brush them because you're told to keep them healthy? So that's how the spine actually is. We want you to keep it healthy because a lot of you are sitting at a desk 8 hours a day. We're carrying kids on our hips. We're getting in car accidents. We're text messaging. So all of those things are causing damage to our spine. And if we don't do something to fix it, it's going to start to deteriorate. And the reason it's so important is because that's what's enclosing that nervous system and it's protecting it. And that's, like I said, your nervous system's the most important thing. We need to make sure we're protecting that. So when your spine's not good, the nervous system isn't going to be good. So now here we have 20 weeks. So you can actually see the embryo is sucking its thumb. So how does that baby know how to do that inside the womb? Did mom have to read a textbook? No, of course not. So this is called your innate intelligence, so what we're born with. So our body is designed to heal and function on its own, from the inside out, not the outside in. So this is what we're working with as chiropractors. We want to maximize that innate intelligence in your body so that you can function at 100%. What is running you? So your brain and your nervous system is like your computer system. So it controls every organ, muscle, and tissue in your body. So we want to make sure all those messages are getting through at 100%. But when you have a misalignment in there, which we call a subluxation, that message might not get through the way we want it to. So when you are getting those adjustments, you are actually going to address that nervous system function. So what is an adjustment? So a lot of people ask us that question. We do a technique called CBP, which is chiropractic biophysics. So we use drop table adjusting. It's mirror imaging your posture. So we took x-rays on your first visit, so you all know what's going on with your spine. So we're actually taking you and putting you in the opposite position. What that's doing is it's retraining what we call proprioceptors. So it's actually going to correct your spine. It's like braces for your teeth. It's braces for your spine. Then sometimes you'll hear a cracking noise when we get some of those adjustments. That is actually going to free up the nerve. It's removing that subluxation and allowing that nervous system to function at 100%. Are you addicted to the crack? So some people think that they need to hear a crack every time they get adjusted. That's just gas releasing from the joint. You do not need to hear that crack. That drop table adjustment is going to give you that corrective adjustment. So we definitely want to make sure we're doing those adjustments. And then, like I said, those other diversified adjustments that we call them, that's just freeing up that nerve quickly and allowing it to communicate more effectively. So where does it all go? So this is what I want you guys to visualize when you're getting adjusted. So if you can see on the left side of the screen, this is called your voluntary nerves. So this is the nerves going to your muscles, so you notice when you get some pain or some tightness. But the right side of the screen is probably what you're not familiar with. This is your autonomic nervous system, or I like to say your automatic. So this is the stuff you don't have to think about. So when you guys are getting these adjustments, pay attention because you can be seeing improvements with things like asthma, sinus troubles, constipation, bowel issues, all because, again, we're getting that nervous system to communicate better. So vertebral subluxation. So you all heard that word on your first visit, and based on your x-rays that you've seen, most of you have these what we call subluxations. That is misalignment of the bones within the spine, and they're putting pressure on those nerves. So you can see on this picture that that top vertebrae or that bone has a nice big open space so that nerve can come out. As we keep getting further and further down, you start to see that nerve hole close down and that disc get really, really small. So this is what we call arthritis. So how many of you were told that you were supposed to get arthritis as you get older? Yes, you're all raising your hands, I see. So I want you to know that arthritis is not part of the aging process. What happens is this is your body trying to compensate and handle this misalignment, this stress, and handle it on its own. So if we remove this misalignment or these subluxations, that arthritis will stop and you can actually reverse this process, which is awesome. So don't let a doctor tell you that this is just supposed to happen as you get older, because it's not. And I can prove to you that because if you look at that top bone, there's no arthritis on that. But look at the bottom one, then there's a significant amount of arthritis. So if that bone is the same age, because it's the same person, there should be arthritis throughout, but there isn't. It's only on where the misalignment is. That's why it's happening. It's not because of your age. So how much pressure is this really being put on the nerve? So the weight of a quarter, which is very minimal weight, is enough to make the nerve malfunction by 60% within 3 minutes. So how many of you guys have actually addressed your problem within 3 minutes of noticing the pain? Probably not, right? So we've waited a little while, see if it'll go away. Look at the malfunction that's happening in the body, okay? So we want to make sure we're addressing and getting to that cause and fixing that nervous system pressure. Handling the effects versus the cause. So you can see that sometimes medical doctors are a little bit different than chiropractic. We actually are looking to get to the root cause of the problems, and a lot of times what medical doctors are doing are giving drugs, which is mostly masking a symptom. And that's how we differ with our care. So I'm going to look at an x-ray very different than a doctor will. I want to address the cause. We're going to see where that nerve is getting pinched and free up that nerve with the adjustment versus just giving you a muscle relaxer and anti-inflammatory to help with that back pain or neck pain. Here's a look at a normal curve from the side of the neck. So again, you can see that those bones are nice and square. There's no arthritis. That's the way it should be your whole life, no exception, regardless of your age. So now you see this is what we call early subluxation, where you're starting to lose that curve. So this person may not experience any symptoms. That's what's scary. They might not know that's in there. Or they might come in with some kink in their neck, like they slept funny. And then when I take that x-ray, we can see that that nerve is getting pinched in that lower neck because that curve's straight. So normally this type of person, I would adjust them. Usually within a couple weeks, they feel better. Their kink's gone. So what do you think happens? Yeah, that's right. They stop coming because they think their pain's gone, so their problem's fixed. See you later. But when you go to the gym and work out and start feeling better, do you just stop working out? No, right? You want to keep it that way because that's what got you better. Same thing with chiropractic. We want to make sure we take a post x-ray. We want to make sure it's fixed on the inside so that you don't have problems down the road. Just because the pain is gone doesn't mean the problem is. So now that person, after they stopped care after a couple weeks, came back a few years later. And now you can see in that lower neck where those arrows are, he's got a lot of degeneration starting in that disc. So now he's got numbness and tingling into both arms and hands, and he's got limited range of motion and some headaches. So now it's going to take longer to fix. It's been in there longer. So I encourage you, be patient, get the correction. Don't go beyond the resolution of symptoms so you can feel healthy and your body's functioning better. And then you can see this person. This has significant arthritis. So this is someone that might be a little bit older. You can see they have hardly any disc spaces left. Their quality of life is very poor. They have minimal range of motion, and they're just not healthy. So we want to catch this as early as possible. That way it's going to be easier to fix. This one is a very advanced arthritis. You can actually see there's no disc space in between some of those bones, and that's where we see fusion. So we do not want to let the body get to that point because there is no correction possible. Basically, you're going to look at pain management with someone with this type of care. So don't let it get to that point. Now you can see this is normal of a back x-ray. So this is looking at someone from the front. They should be straight, right? So that one looks straight to you. Now, you might have heard this term. We call it scoliosis. So you see it happen a lot with kids. It's where the spine shifts off to one side, maybe a C curve or an S curve. A lot of times it's genetic. We see it run in families, but a lot of times you're also told by an orthopedist that scoliosis, you can't really correct it. You can brace it to try to prevent it from getting worse, or you can have surgery and have rods put in. But with this type of chiropractic that we do, called CBP, I mentioned, we can actually structurally correct scoliosis. So this is a little girl that came in. She was about 10 years old. Within a few months, she saw this correction. It's amazing. She did the adjustments, and then we did traction laying on one of our tables, and her digestion's improved because remember that those nerves are going to the bowels. No more constipation for her. Her parents are extremely happy. It's going to save her a ton of arthritis problems down the road. So you can correct it if you catch it early enough. So growing pains, how many of you have heard of that or maybe had that as a kid? They say when you're growing up, your legs start to hurt. Well, normally that should not happen. Every part of your body's growing, but why are only your legs hurting? So what's happening is that's usually when a scoliosis is starting to develop. So a lot of times when I hear my parents talking about their kids suffering from growing pains, I recommend that they get checked. Kids need chiropractic too, and the earlier we can catch it, the better off they're going to be. Bedwetting. That's another thing we see in our office with kids. You can see again that shift in that spine. That L5 nerve down in the bottom is feeding your bladder. So when it's getting pinched, we might have some bedwetting issues. And within 1 month, this person was corrected. Sometimes within 1 or 2 adjustments, they notice the bedwetting go away. So kids can benefit as well. And then here's just to show you some positive change in our office to encourage you that you are going to get these same results. This person came in with a lot of what we call posterior translation. So they kind of had a hunchback. And you can see within about 6 to 7 months of care, we got it cut in half down to 43 millimeters. So it takes a while. You got to be diligent and you got to be consistent with your adjustments and traction, but you will see the change, and we will show you that on a post x-ray. So this person's so excited about their change, and it's actually a kid, believe it or not. He's less self-conscious with his body. He's doing really well in school, and he's just really, really happy. Another thing that we do kind of see in our office that does extremely well with chiropractic is what we call ADHD, ADD. These are all neurodevelopmental disorders. The reason why chiropractic can help is because we're adjusting, again, that nervous system, which these are neuro problems. I took a whole neurosensory certification to work with children with these types of issues. So we actually have a whole program in our office where we do adjustments and traction if they need it, and then we also do sensory exercises. So we help retrain those neural pathways that weren't functioning right to begin with. And they see significant improvements, and then we will also address diet. Diet's big with these kids. We can cut out some things, eliminate, add some probiotics, add some enzymes, and it's amazing when you heal their guts, the improvements that they can see as far as their behavior, their attention, their concentration. It's amazing without having to use drugs. So if you know people that are looking for alternatives besides medication for these kids because they have significant side effects, let them know about this type of program. So this is just a picture of one of our little girls getting traction. So as you can see, it's really gentle. She's just laying over a little foam bungee, and that's putting that curve back in her neck. So she actually came in because she had getting sick a lot of sore throats, a lot of ear infections. Ever since she's been getting adjusted, she's hardly sick at all anymore. This is happening because we're, again, addressing that nervous system, which directly is communicating with your nervous system. So you all, too, adults, should also see improvements with your immune system. And then this is a little boy. He is not my patient, but he was very sick until he was about 18 months old. He suffered from asthma, bronchitis, and basically the medical community put him on puffers and antibiotics. And at such an early age, that can have long-term effects down the road. So his parents wanted to try something alternative, so they took him to a chiropractor up in Canada. And within 1 month of chiropractic, he was able to get off all of his medications. So again, it's just getting that nervous system to communicate better. We're not treating asthma, we're not treating ear infections, but those things do get better because your body's healing on its own. And this is another little girl who, this is an amazing story, and we hear these types of stories all the time when we go to chiropractic seminars. And we have these same stories in our office as well. She was 18 months old, and she had a lot of trouble sleeping. Basically, she would not sleep. So her parents kind of took turns staying up with her each night, and it took a toll on their lives as well. So she had CTs, MRIs, neurologists, everything under the sun she was looked at, and they couldn't figure out what was going on with her. And basically, they were told that eventually she'll grow out of it. So one of their neighbors approached them and said, listen, I go to a chiropractor, and he's got a lot of kids running around in there. Maybe he can help her. I don't know what they're in there for, but it would be worth a chance. And of course, being desperate at this point, they did set up an appointment with his name was Dr. Ogi, and he evaluated her, and he did an adjustment that visit. He did one adjustment on her upper neck, which is your upper cervical spine, and when she got up from the adjustment, she fell asleep walking on of the office on her dad's shoulders. And then he called them the next day to see how she had responded to the adjustment, and she had slept 12 hours that night. So that was with one adjustment. So these miracle cases happen all the time, and it's just because you're getting your body to do what it's supposed to do. Most likely, she had a subluxation from that birth process. It can be very traumatic, not only for the mom, but for the baby. So we always encourage our moms and dads to get their kids checked early on. I have newborns coming in right after they leave the hospital, which is awesome. So we get them checked right from the start. They get a healthy life from the beginning. And this is actually me adjusting one of our newborns. You can see it's extremely gentle. Chiropractic is very safe and effective for kids. It helps with a lot of different things and just keeping them healthy overall. But it's a gentle technique on them. We're not putting them on our table and cracking their necks and twisting their spines like people think. So I encourage people, if they've never had their spine checked or if they've never had their kids checked and they're experiencing some immune system issues or digestive issues, to try chiropractic. It's a safe and effective approach, and we do really well in this office helping a lot of families. Now, the only thing I like to cover as well, besides chiropractic, is obviously chiropractic's not the end-all cure-all. So we do like to cover a couple other things that we want you to be doing at home. That's why I do this orientation. So what you do at home is also going to help us with what we do in here. So as far as water, I found that most people do not drink enough water. So we want you to be drinking half your body weight in ounces. So if you weigh 150 pounds, you want to be drinking 75 ounces of water a day. So if you're not there, start gradually working up to that. Make it a process, okay? It's not going to happen overnight. Exercise. We want people exercising 3 to 5 days a week, at least 30 minutes. So we got to get some cardiovascular activity going. Nutrition. So I tell people to focus on the outsides of their grocery store. That's where all the natural things are, your fruits, your vegetables, your meats. That's where we want to focus. All the processed junk is up the middle. I encourage people to start reading ingredients labels. If you can't pronounce it, don't eat it. That's my motto. And if you have any other questions as far as nutrition, I have a nutrition background with my neurosensory program. I can give you some more information on that. And then the last thing is sleeping. So we want 6 to 8 hours of sleep is ideal. People are asking me all the time about mattresses, pillows, things like that. So 1 pillow should be enough. Medium to firm. I'm not a fan of those memory foam pillows. I don't think they support you enough. We do recommend what's called a ChiroFlow pillow. It's a water-based pillow, but it provides the support, but it's comfortable. And then as far as mattresses, I don't recommend a specific brand. Usually all those name brands are great. You just want to make sure you get a mattress that's medium to firm, so it's actually supporting that curve. Now, is there any other questions that I can address before I let you guys go? Great. I just want to thank you all for coming tonight, and I hope that you've learned at least one thing that you can maybe take away and start implementing into your life. And I know you guys are going to see great results, and your body's going to feel better, and your body's just going to be functioning so much better, and we're looking forward to making that change for you.